Well, good morning, everyone. I have 8 o'clock, so we're going to go ahead and get started. I'll call the meeting to order. Once again, I'm Katie Galbraith, and as we get started, I would draw everyone's attention. You should have the agenda in front of you that was sent last night, but I would draw everyone's attention for just a moment to the equity framework to guide our considerations and recommendations, because I think it's really important that we make sure we're grounded in this. So for any recommendations that are being considered, task force members are encouraged to ask the following questions. Who will benefit from and who will be burdened by decisions or recommendations made? What are the unintended consequences of decisions or recommendations? And what can be done to mitigate harm? And then additionally, we're encouraged to use data, preferably data disaggregated by race whenever possible. And look at whether the data tells a story about disproportionality, and if so, what is learned that could be influenced and be integrated into decisions or recommendations that are made. So I think that's just an important reminder of the framework we have, really framing this around equity as we move forward. With that, we're going to start this morning. A lot of great work going on. First of all, I want to say that another very busy week, and so I appreciate so much everyone here and all that you are doing to really give back to our community in this way. We'll go ahead and start with our priority update, which is an update on state and local orders and what differences will remain in the local orders on June 1st and why. So I will turn it over to Mayor Schewel and Chair Jacobs.
Chair Jacobs is going to get us started.
Thank you, Katie, and good morning, everybody. Hope everyone's had a good week. It's a little scary how quickly a week seems to fly by when we're all sitting at home in front of our devices. But just to give you an update on where we are today, the good news is, according to the latest data that we've gotten from Duke Academia, our rate of growth has declined a bit. So from last week, we were at a 3.7% rate of growth for positive cases. And today we're at, well, as of yesterday, I think it was, we were 3.2%. So that's good news. The other good news is that we are now more consistent with the state rate of growth. Excuse my dogs barking there. And we're actually now, the state is also at a 3.2% rate of growth. So that is important as we look to revising our stay-at-home order today, which the mayor will talk a little bit more about. And the other key point I want to raise, though, is we have Rod with us, and I know he's going to speak a little bit more about this today. And thank you, Katie, for reminding us of the equity framework, because I think this data point is really important for us to delve into a little deeper, and that is what is happening with the rate of growth in our Latinx community. As of yesterday, the report that Rod gave to the Emergency Operations Center and on our multi-agency call is that we are now at a rate of 34% of our cases being within the Latinx Spanish-speaking community. And this is very concerning because that the demographic is only 14% for Durham County. And Rod will go into more detail. He's got some excellent data, even breaking it down by employment sectors. So I think this is really important for us to understand what is actually happening and the work that is happening, thanks to Pilar and many other partners and Rod, but I will let him speak more about that. But that's just to give you an overview. I have reached out directly to Secretary Cohn. I know others are working on, requesting from the state that we get the number of positive cases, I'm sorry, overall testing being done for Durham County so that we can really understand what is our overall positive rate of growth within Durham County in the context of how much testing is going on, because we know there is more testing happening. She indicated that she would follow up on it. This was yesterday. And she was hoping to get us that information within the next week or two. So the Department of Health and Human Services is aware of what we need, and I think others have been trying their best to get this information. Evidently, it's complicated, but this is going to be a really important point for us as we move forward, and I think we'll probably talk more about that again later in the agenda. And I'll turn it over to the mayor to go into more detail about what our next revision of our order looks like at this point.
Thank you, Wendy. Good to see everybody. What an awesome group. And I just can't believe how quickly you all have sprung into action. Maybe I should believe it, because it's just an amazing group of people. And I just want to express my gratitude, as Wendy did, to each of you all. We're so grateful for you all helping to lead this effort and lead our community through a really difficult time, but we have the right group of people to do it. We will make today, Wendy will sign and I will sign a city order. Wendy will sign the county order. I will sign a city order incorporating that order into the city that will, as of Monday, June 1st at 8 o'clock, change our stay-at-home order to a safer at-home order. We will still be recommending, strongly recommending, that people stay at home unless they have some critical reason to be going out. We have done a very good job in fact, right now our statistics that our Emergency Operations Center folks shared with us show that we're the county in the state where people are doing the best job of staying at home for non-critical travel. And so that's great, but we have to keep it up if we're serious about trying to contain the virus. This safer at home order will allow all of our business to operate. They can operate under the governor's order, which will include restaurants, salons, and pools. And our lawyers have been going back and forth about how to, we want the distilleries and breweries to be able to operate, and that'll be in our order too. As you all know, there's some legislation that's been passed. There's some consideration of whether or not the governor will veto it. Our lawyers, Anna's here, she and Curtis Massey from the county have been going back and forth figuring out the best way to deal with this in our order thoughtfully. There are some differences that will remain between our local order and the state order. We will continue to be requiring face coverings in places where people are not able to socially distance. The language that's in our current order will remain. And we feel like that has been getting lots of good voluntary cooperation and has been successful, and we believe it will continue to be. We'll continue to have a 10-person maximum for mass gatherings outside and no inside mass gatherings. We have a limit of 6 people instead of 10 at a single restaurant table unless people are related. That's based on DHHS guidance. And also based on our mass gathering regulations, there'll be no real estate open houses. We know that the real estate community is interested in figuring out how to do that safely, and we're looking forward to our real estate roundtable advising us on that in the next week. So those are the main areas of difference. As you can see, we're opening up lots and lots of things on Monday, and our community needs to continue to do it all very safely, and that's that's some of our work here today. Finally, I'll just say I'm very excited about today's areas of focus. The work on the key metrics, and Wendy mentioned one of the ones that we're especially concerned about, the ability to know the number of tests so we can know the number of % positive. And I've also been in touch with the governor's office about it, and folks are working on it at the state level. Rod's been working really hard to get this. I'm glad we're going to be focusing on the public health data, and Rod's done a wonderful job of helping us think about those trends. And Wendy's already mentioned probably the most critical trend we've seen lately, which is the increase in cases in our Latinx community, which is we very much need to take on. I'm so impressed with the work of the roundtables. If you haven't read the clergy solidarity statement yet, it's fantastic, signed by many of our leading clergy, and I really want to thank them. Our restaurant work, our childcare, our communications team, so many of you all have been doing wonderful work, and I'm so grateful. For thinking about the homeless and Latinx populations, and we'll talk about that today. The PPE work, I know that there's been a tremendous amount of work on that. And then the thinking about voluntary cooperation, self-certification, the work of the Center for Advanced Hindsight. I deeply believe in that and am grateful for them for this work. And then finally, the thinking about the economic recovery. I want to say that in that light, we're having this morning, after this meeting at 11 o'clock, a small business forum. It's a public meeting. Anyone can listen in. Wendy and I will be there, other city council members and hopefully county commissioners, and we will be listening to our small business community to hear about their concerns. The city has allocated $1 million to support our small businesses, along with $1 million from Duke, and we'll be rolling this out as soon as we can. So there's a lot happening, and I just want to express my gratitude to you all because you're the ones that are making it happen. So thank you very much to our chairs.
Thank you very much. Are there any questions for Mayor Schewel or Commissioner Jacobs before we move on to the next section of our agenda? Okay, Maticia, I will turn it over to you.
All righty. Good morning, everyone. Even though this has been a 4-day work week, the work that you guys have accomplished doesn't feel like it's only been 4 days. So many thanks to you for your great work, for your commitment and your continued engagement. We want to spend a little bit of time talking about some metrics. There's a lot of published information on a variety of metrics. And I saw even on the news this morning, there was a discussion about metrics. And these metrics can be overwhelming, they can be confusing, and sometimes they can be misinterpreted. So as we advance forward with our mission, we thought it was important for Rod and Dr. Akinboyo to educate us on some of the published data, the published metrics, educate us on where these metrics can be found, educate us on what these metrics really mean, and help us have a conversation around key metrics that we should be focused on as a task force. So with that said, I'm going to turn it over to Rod and Dr. Akinboyo to walk us through the metrics discussion.
Good morning, everyone. Can you hear me?
Yes.
As Maticia said, this was the charge that Dr. Akinboyo and I were given, and we took it seriously, and we took some time to really be pensive and intentional about the information that's going out to the community. We definitely heard George last week pretty much say, you know, hey, what exactly does this mean? What do these numbers tell us? And it's easy for us to really get wrapped up in the work that we do and thinking that our message is coming out clearly to the community at large, but we found that in most cases it's not. So we've done an admirable job with the data hub and making it that central core vehicle for disseminating information, but we thought that would probably be great to indicate those areas that the citizens at large should really focus on. So Dr. Akinboyo and I got together along with Maticia, and we just said, you know, what are the 3 things that we really want people to understand? And of those many metrics, we came up with 3 things. Number 1, we definitely want folks to know what the case count is. That's something that's not going to necessarily go away anytime soon. The cases will continue to increase as we continue to open. That's just being very realistic. However, there's going to come a day when the cases will, the the frequency of the increase will decrease. And then we in turn will either begin to plateau, and we will definitely start seeing less numbers come about. The second thing which we felt was most important was the rolling average, or the 7-day moving average. That's the number of cases that we have over a period of time. And Dr. Akinboyo can attest, that really paints a very vivid picture of what's truly going on in the community, because we're taking that average of the number of days that are out there. And last but not least, as Mayor Schul and Commissioner Chair has mentioned, the number of tests, the total number of tests, to include positives and negatives, because it gives us our ever needed numerator and denominator. Numerator being the number of positive, denominator being total number, which gives us what we really need, which is the positivity rate. That really tells you what the total amount of infection is inside our area. I send my sincere gratitude to our two leaders, Katie and Maticia, and also to the mayor and the chair, because this is something that I've been screaming up and down, jumping up and down, really telling them, like, I really need this. I really need this. And it's great to know that my elected officials have my back. So thank you for speaking out to the governor's office and to Secretary Cohen to reinforce what I really, really need. I don't know if Ryan is able to put my information on the screen just yet. Okay, so again, with the data hub, you definitely have just basic information. Again, you come here and you have total number of cases. Of course, we have average age. This is information that the general public at large is used to. We wanted to start off by providing this information just in the spirit of transparency. We also continue to listen to the comments that we get. And as I said so many times before, the comments are great. Some are constructive, some not so constructive, but we take it all in stride. And those comments that we really feel are beneficial, we listen. So in other words, like when you see 971 released from isolation, that simply means that 971 individuals have recovered. One comment that I certainly get is that we shouldn't just put cumulative, but what I've tried to explain time and time again is that in public health, that is sort of a public health way. And the coronavirus has really, really caused us to really look at our processes and to really turn away from some of the ways and tried and true methods that we've used so many times before. So we put that out there. And of course, if you were to subtract the two, that would definitely let you know what are some of the active cases, or the majority of the active cases that we have. We wanted to give the percentage of male and female. And then, of course, with the demographic information, that's important as well, because we wanted to be able to show, the demographics that are involved in everything, how the coronavirus is affecting every facet of what we do. As the mayor and chair have alluded to, race and ethnicity is extremely important, because we certainly want to ensure that the different demographic areas of our county understand how they're being impacted. As we've mentioned before, we're continuing to try our best to support and make this a very, very good tool for the community to know exactly how they're affected. So again, when you see the race and ethnicity summary on the data hub, it's important to say, why is it important to look at this information? Again, we're promoting health equity, which is central to Durham County's health department's value. We want to make sure that healthcare is equitable and it's without borders. And then again, a history of structural racism. We acknowledge that it creates inequitable access to healthcare and heightened disease exposure or risk of disease exposure. So we want to make sure that we are able to break down those barriers. And again, is race and ethnicity distributed through the cases, which is representative of Durham's population overall. This information is important to letting our community know who's at greater risk, who's at lower risk. And again, we want to make sure that information is out there. And then, of course, when are cases being identified within race and ethnicity groups, may be a question. And of course, this can be reflective of risk and exposure and access to testing. We want to make sure we know who has access to testing, who can stay at home, who's protected at work. So this information is out there. Then we have monthly race ethnicity trends. That kind of information, I'm trying to follow Brian as he goes.
Sorry, do you want me to go back, Rod?
Can you go to the document that I sent to you?
Oh, sorry, I didn't see that, Rod. I apologize.
Okay.
I'm not sure that I'll be able to pull it up in a time that will make sense now, so I apologize. We'll have to make do. Please direct me.
That's fine.
So I have it up if you want me to.
Do you want to share?
Yeah, if I could do that.
Okay. My apologies.
So as you're discussing, I'll pull this up. Just trying to make it large enough so I can share one screen. I have multiple screens here and this may cause a problem. But please continue. I'll pull it up shortly.
Okay. So in a nutshell, what we're trying to create is a weekly reflection of what we're seeing and overall case trends, and just to give the community a greater snapshot of a very clearly defined interpretation of what the numbers were. So we want to start off by being able to say, again, what were the total cases? Was it an increase from last week, decrease from last week? Now, fortunately, for the week of May 25th, we saw an increase of about 292 cases overall. Then, again, the 7-day moving average of last week from this week was 41. This is up from an average of 20 from last week. So again, the 7-day moving average really indicates what's really going on in the community. So when we watch the total number of cases, we understand the total disease burden within the community. Again, the 7-day average is a weekly average. And again, it re-estimates every day. So it will decrease as the rate of new cases slows. And conversely, it will increase as the rate of new cases increases. So of course, we watch the 7-day average to determine if trends in cases are increasing and decreasing. On the
Rod, can I ask you a quick question? So
Sure.
As you talked about, so one of our key metrics is number of cases. And I think, yeah, right there. So weekly reflection, case increase of 292. Is that good? Is that bad? Should we be worried? Like, how do we interpret that information?
Well, it depends. And again, and as Dr. Akinboyo can attest, for example, if one day in the recent past, we had an influx of like 153 cases in one day, Maticia. So again, it's all about determining where that came from. So we know that long-term care facilities, and particularly correctional facilities, did mass testing. So that came from Butner Correctional Facility, and that was pretty much like one day where the 3 buildings that are on Durham soil were tested. The information was submitted to the North Carolina Electronic Disease Surveillance System, and Durham got all those cases in one day. So if you're talking about over a weekly average or weekly time period, it can be a little bit confusing. So again, the weekly reflection will give me the opportunity as the health director to really articulate what the numbers mean. So I hope that answers your question.
It does. Thank you.
So again, the teal line is the weekly average. And we did a pictorial because we wanted to make sure that on this graph, we could see the highs and the lows and when it all flattens out. So again, that is the most important, probably the most important metric that we feel that the community should see and understand, because it gives a real true depiction of what is really going on in Durham. I just want to make sure I cover all the things on the top. I think I did. So we did mention about, again, race and ethnicity and all the things that come with that. So we want to make sure that, I wanted to make sure I did that. But again, we want to make sure who's at greater risk, and we want to make sure that we cover the monthly and the overall race and ethnicity information. So speaking to what the mayor and the chair said, our Hispanic and Latino individuals are overrepresented. What does that mean? That means that for them to represent 13.7 rounded up to 14% of Durham County's residents, they are basically 34% of all of our cases as it stands right now. So clearly they're overrepresented. And the Black or African American community, which represents 37% of Durham County's overall residents, they're at 42% of all cases. And again, we're talking about for this particular week. And then for our residents identified as white, represent 54% of Durham County's population. They represent 26%. So they're underrepresented, along with Asians and American Indians, Alaska Native and Native Hawaiian, Pacific Islanders. They are underrepresented, and this is what the number and the data shows us. And then we also go to really showing what that looks like on the graph. So again, to your point, Maticia, somebody would look at this and they'll say, okay, nice numbers, pretty graphs, but what exactly does that mean? So the weekly reflection, which I might add, will be published after today's task force meeting here on out. We want to make sure that we publish it on our data hub, but we wanted to introduce it to the community and the task force first. Then we go toward work, race, and ethnicity. People are concerned about what does it really represent on the job front. So we wanted to make sure that based upon 10 or more cases, we could show where our positive cases and what employment industries they're located. So again, nursing care facilities, that's an easy one, again, with long-term care facilities being centers of outbreaks. They're probably ranked the highest. And then correctional facilities, as I mentioned with Butner, and their testing. But then most concerning with the Latinx community is the construction industry. And we're seeing a lot of cases that involve construction through the use of contact tracing and contact investigation. When we talk to these individuals and we ask them, where do you work? And they say construction. So we're able to relay that information to hire in an effort to form some type of strategy. Then of course, unknown is a big one, because again, folks don't want to divulge it because they fear their employers, retaliating, so to speak. And then of course we have some others to include janitorial, university settings, and others. Let's see. And then we wanted to make sure that we also give information as percentage of workers in each industry. So again, right here you see nursing care facilities representing bulk of the ethnicity. And then we have construction, we have a number of others. I'm trying to pause for a second so I can go back to my notes and make sure I cover everything. Okay, so as far as raw data, what does it tell us? Again, 67% of our cases were associated with nursing care facilities. And within those long-term care or nursing care facilities, ladies and gentlemen, were the concentration of Black or African Americans. And then of course, as unfortunate as it is, 53% of our cases that came from correctional facilities were Black or African American, but 91% of our cases associated.
So it sounds like we lost.
All right, I think he
Rob.
cut out.
Yeah, look, he may have gotten dropped for some reason.
Yeah. So I think certainly Director Jenkins covered and is maintained a lot of this, so I certainly don't want to steal his thunder. But I think some of the areas that we wanted to highlight have been highlighted. And one key point here is that the main metrics that we have discussed are what we're going to continue to follow and potentially ensure that this is publicized not just within our group, but in any other format, particularly on the data hub as well. So just reflecting, again, we're going to look at number of positives. This is just breaking them down by insured versus community-based. So number of positives, positivity rate once we get a total number of tests, and then our total number of cases each week. So if there are questions, I think we would collect them from our group, but as we also have roundtables, if there are questions related to data, one other way we think would be helpful if those are collected in some way and filtered to us so we can address the direct questions that are coming from the community. So I'll pause there and hand over to Maticia. And then
All
I'll
right.
also stop the screen share, Ryan.
Okay. Thank you very much. That was great information, Dr. Akinboyo and Rod. Hopefully he's going to join us again. Any questions from the task force on the information that was presented?
So I have a question. So all these data will be public, so people is going to be able to see the desegregation by but jobs and everything.
I think that's the current plan. So again, I will defer to Director Jenkins as to the public health plan around this, but this is already incorporated into the data hub. We are summarizing data that's publicly available in ways that are almost bite-sized and can ensure that people are getting the information they need. But this data is already publicly available through the data hub.
And we'll make sure that we send out the link to the data hub, because I spent some time this past weekend in the data hub playing around, and there's a lot of great information that's there. So we'll make sure that we send a link out to the entire task force.
Pilar, do you have questions or concerns about the way it will be presented?
No, I think one of the things we've been talking about a lot is the communication piece, and mainly for our Latinx community. So I think actually yesterday I had a meeting with all the media outlets in Spanish, and we were talking about a communication campaign together, unifying the messages. So I will connect with them. And one of the things we talked was letting out information about how to protect yourself depending on the area of work. So this is very helpful. It's why I'm very interested in seeing again that piece and being able to share with them to see, to start targeting our messages to the community depending on the area you work at, because there is a lot of information how you cover your face and all of that, but how you work in a construction site with a mask and all of that. So this is very helpful. And again, I will connect with them. And the idea is to all of us giving a unified message. So the community sees it's not only, El Centro saying it or Que Pasa saying it. It's all of us saying the same thing. So the community feels more comfortable with the data. So we will work on that. But also, again, I will gather if you have any other ideas or other ways to do it, but we are working on that, because I think it is very, very important how we communicate to the community all of this.
I just to reinforce the point, I live in a new neighborhood in East Durham that's very much under construction. There are probably 15 homes being built right now, and the use of masks is minimal. And I don't say that to point a finger at the Latinx community. I'm very suspicious of how serious the builders are taking what appears statistically to be a heck of a serious problem.
Yeah, and I think, the other thing I gathered from a community meeting I had with some people is, yes, how to get also the masks and how the contractors can, enforce this piece. But also I think it's important again because some of the feedback we get is, as I said before, how can you work and breathe with a mask all the time when you're doing this labor? So getting some information from, the health department and probably Duke and see how we can, so the message is not only cover your face and here are the masks, because we are working on that and getting the cloth masks or other ones, but how is really appeal to that sector, to the specific sector, and is healthy too. So gathering all that information to make it, to be able to get it.
I'm glad to see that Dr. Jenkins is back. I think one thing I should make sure we mention is we are working to be upfront about data. We know that data can be interpreted in many different ways. The goal here is not to increase any form of stigmatization of any group, and it's particularly just to highlight are there ways in which we can target education to reach those that are most affected, or target resources that are available to certainly reduce transmission in settings that are not easy to remain socially distant or to practice some of the guidance we've put out there. Can it be more practical for different settings? And then Director Jenkins, we summarized briefly some of the rest of it, and then we were going through questions just to catch you up.
Thank you so much. I do apologize. The power blinked in my office, so I ended up coming to the Emergency Operations Center to finish it off. I do apologize for the momentary absence, and I have no doubt that Ibukun did a great job. Willing to entertain any additional questions you may have, and again, I do apologize.
I have a quick question regarding the roundtables. Are there any roundtables that are designated for the construction industry? And if not, are there any that are planned for the construction industry?
I'll let Brian take that. Brian, you might be on mute. We can't hear you.
Thank you. We do have plans for one next week.
Great, that's excellent.
I'm wondering about making the data as operational as possible, and if there are areas in which we can establish some goals or communicate some goals that we're working toward, or communicate based on the data what additional steps we should take. I think we could look at it, for example, and say, well, it seems that we need to do more outreach in the Hispanic community, for example, but going beyond that into exactly what actions should we be pursuing as a task force, and are there places where we need to make a course correction? I'm wondering what your thoughts are on that.
I absolutely totally agree with you, Susan. That is something that we need to do, and again, it is a kind of case, we've kind of had a case study over the past couple of weeks and everything you just mentioned. When the data showed us that there was a significant uptake, we in turn took the data, put it in the form of a presentation, and we presented it to the community healthcare advocates that we have, our community partners, and then we took it to Pilar and her Hispanic advocates and the Latin 19 advocacy group that meets every Wednesday at noon. And, by the time we got it to them, they'd already heard some things. And for the most part, it was a call to action. I believe Viviana was a part of the original group as well. And from that point, we really started strategizing. I will say, Susan, we didn't necessarily come together as a brain trust, if you will, but every group began to strategize, and public health was involved at every turn. So when it came down to awareness and things that we can do, we were able to listen to these different groups and be able to, really retool what we do in terms of our media campaigns and our information sharing. But then we also were able to avail ourselves to be able to be present, to do Facebook Live sessions, to be able to meet with them doing Uber conferences to keep them abreast of what's going on and use platforms like this to really get the word out. So as far as like operational strategic steps, I'd say we had not really formally done it, but we ended up informally doing it. But that's a great suggestion.
I
Just add,
Susan.
Susan.
What Susan said. I mean, it's been helpful for me to hear it. And I don't know if there's a way that the task force could get an update prior to our meetings on Friday. And I think it would be helpful as we're doing some of these roundtables, if this information is shared. What I know with the restaurant roundtable last week, when we were able to have Chris Salter attend that, he was able to answer a number of questions that put them a lot at ease. So leading with the health information, leading with the data, allows people to understand, well, why are we doing 6 and not 3 feet apart? What does that matter? How do people interact? But by leading with that, it really kind of frames the conversation as opposed to, this is what you're going to do. It seems less, there's a reasoning behind why the requirements are being set out the way they are being set out. So I don't know if my other fellow task members would agree, but it was helpful for me. You know, if there would be a way to get this maybe Thursday and we can review it and then have you at the very beginning, you and your team at the very beginning kind of go over and highlight some of the things that we need to be aware of. And then we can take that out into the community when we're doing our roundtable meetings and any other meetings that we might be doing unrelated to the task force, but that could really push this information out. Because I don't know that people are going to go to the data hub. I've sent it out, but you know, it's a lot of data. And then as someone mentioned, you can construe the data any way you want. Numbers can say anything you want. So being able to have you speak very, very concisely about, and this is what the numbers are saying. We're trending up here, we're trending down here. Restaurants, you need to be concerned. Retail, you need to be concerned. I think would be helpful, and would love to have this as a standing part of our agenda every Friday with information sent the day before, if possible.
Consider it done, Nicole. That's an excellent suggestion. And again, you must be a soothsayer because that's exactly what we intend to do. We were fortunate enough to give it to provide this information to the multi-agency coordination group, affectionately known as the MAC group, with Chair Jacobs and Mayor Schul. And that's the exact same thing he asked. He said, you know, when do you intend to publish this? This is good information. So we just, you know, we'll definitely follow suit. So thank you for that suggestion.
Sure. No, thank you for all your work. I really appreciate it. Thanks a lot.
No problem at all.
Rod,
and it's also Dr. Akinboyo. Okay, I can't take full credit. She's awesome. She's awesome.
Yes.
Rod, just before you dropped off, it seemed like you were leading up to a grand crescendo, and your voice kind of raised, and you said 98%, and then you dropped. I don't know what you were about to say, but if you can kind of rewind and remember what that 98% was, I was waiting with bated breath, like, okay, what is this 98%?
Actually, it was 91% of our cases were associated with construction, and the settings were really specific to the Hispanic and Latino population. So,
Gotcha.
you know, again, I apologize for our technical difficulties, but I'm just really trying to hone in on that point that, you know, and as Brian said, the roundtable for construction has already been established, and we look forward to really speaking with them. And as Pilar mentioned, possibly giving them some public health guidance as to things that they can do. But I do apologize for being cut off.
Alrighty, great discussion on the metrics. Really appreciate the hard work from Rod and Dr. Akinboyo. You know, agree with the comments that we should have this as a standing agenda item because I think as a task force, we need to use these metrics to help inform actions that we're taking, help inform any advice or recommendations that we make to Mayor Schul or Commissioner Jacobs. So looking forward to continued dialogue around the metrics, and as Rod and Dr. Akinboyo continues to educate me and say, you know, you just can't look at one data point. We've identified our 3 key metrics, but there's other things that we need to take into consideration as we look at these key metrics, and things may appear on the surface to appear not in the range that we wanted. So I think the continued dialogue is going to be extremely important. So again, many thanks for your work on this. So now I'm going to turn it over to Katie to get us some updates on the roundtables.
Great, thanks, Maticia, and great dialogue. Really, really good discussion. So thank you all very much. I'm actually going to turn this over to Brian for a very brief update on the roundtables, looking at which roundtables have met, what we're hearing from specifically those for the groups that are opening on June 1st and where they are, and what roundtables are planned for next week. So Brian.
Thank you, and good morning again, everyone. Certainly been a busy, short week. Especially want to acknowledge all the public servants on this group. Budget work sessions are time consuming but important for our community, and thanks for all the work that's going on there. I'll say that with our roundtables, we have had a lot of continued dialogue by email and sometimes by phone with the ones that have started, but did not have as many have regular meetings this week because of the packed week, I guess. I will give Dr. Davis and Susan a chance to comment quickly on some of the specific roundtables that did meet this week. But I would just note that we are starting to see some trends emerge, and really it's starting to think about things beyond reopening. Most industries are starting to receive good public health guidance from the state, and within all of those industries, some are prepared to reopen immediately. Some are going to continue to operate below capacity, and unfortunately, some have paused operations or closed. All of them are having concerns about legal liability. There is some good general guidance out there about documenting how they're following public health recommendations, but then certainly financial resources and needs for flexibility and space and permitting and things like that. So since our meeting last Friday and the meeting that Nicole mentioned with the restaurants where environmental health was able to talk through some of the benefits of the Count on Me NC program that was developed by the state's cooperative extension in partnership with Visit NC and some other marketing folks. There has been some general uptake in that as a form of voluntary self-certification for several different industries. I'll note that on Tuesday of this week, they expanded the online training modules that are available through that program to include general guidance as well as a cleaning and sanitizing setup. And so what we've already seen is that we've got dozens of restaurants who have already completed the training. You can see all this on the website, in addition to some other establishments, lodging, and I saw that the county's public health and environmental health departments were also amongst the people who had completed the training. So with that expansion of the guidance that's available through that program, that does have very specific modules that include fitness centers and pools, barbershops, salons, and personal services, and lodging. And so I think that that's a good interim step that some of our businesses that are reopening are taking. And with that out there, I would say that there's also a recognition that that program itself doesn't necessarily support every industry. The idea of putting a dot on a map. So particularly with summer camps and with construction and utilities, as well as I would think places of worship and realtors and other interactive services that were mentioned, I think some sort of a complimentary voluntary self-certification program will be a great addition to what people can do to signal to customers as well as to their employees how serious they're taking their obligations in doing business in this environment. With all that said, I would ask if Susan had any quick takeaways from restaurants or lodging, and if Dr. Davis wanted to give any quick follow-up on the places of worship.
Sure, I would say another common theme that we're hearing is just the concern about trying to enforce behavior with patrons, and particularly with regard to masks. These are hospitality businesses. They are very customer service oriented, and as we have probably all experienced ourselves, there are some people who are pretty adamantly opposed to needing to wear masks. So I've seen a lot of discussion about what's expected of them. Are they expected to prevent people from entering, or how heavy-handed do they need to be with enforcement? So I would say that would be something that if we could provide some guidance, or what are the expectations from the overall community standpoint about each one of these businesses, that helps give them a little cover, and I think they would appreciate it. I know in the lodging one, there was a lot of discussion about how do you have that conversation with a guest, even coming down to that level of detail. It's when you think about it, it's a little challenging, and I know that's going to be faced in a lot of these different categories.
If I could, I got a quick question, Susan. I'm sorry. Is the language in the order? Maybe this is more for Steve and Wendy. Is it a required face cover or recommended?
It's required in our ordinance if you cannot safely social distance from another person.
Except in restaurants where you're eating and drinking, right?
Right. In restaurants, it says, yes, when you're eating and drinking, you can remove your mask. Yeah.
Okay, thanks.
And also public transportation, you will not be removed if you're not wearing a face covering. It's explicit. Yeah.
So that I've heard that theme in several of these different roundtables about just how far is the business owner expected to go, or the host at the restaurant, for example, in enforcing that. In the case of the lodging roundtable, there are standards within the Count on Me NC program Brian was referencing that have been set by the American Hotel and Lodging Association, and those are standards that these hoteliers were already adopting. And as we know, they were not ever required to close, so they have been putting these in place. So I think they are, and they were very amenable to endorsing the Count on Me NC program standards as what they would follow. And I think that's all the new things I would add to what Brian's already said.
I have a question about restaurants. This is mentioned on the agenda, and I was hoping we could get some comment. The city is very much interested in outdoor dining and has been working really closely with Downtown Durham Inc. And Downtown Durham Inc. has been working with the chamber and the restaurants. And I was wondering where we were on that. And so that's one thing that I'd love to hear about. But let me also just comment briefly about what Susan said about and Jeff asked about also about the face coverings. We recognize this has been, this has been a constant issue. You don't want a 17-year-old clerk trying to enforce a masking requirement with an angry patron. We all know that. And so we have not been demanding of our businesses that they do the enforcement. We understand that difficulty. It is a difficult and a balancing act. I've probably got 50 emails this week from patrons saying, I've been to so-and-so and people aren't wearing their masks. I mean, it is true that a lot of people don't feel confident still unless people are wearing masks where they are. So it is such a delicate balance. And I just want to recognize that, how hard that is for the businesses And Susan, appreciate you forwarding that. I'm hopeful that one of the ways in which we can, our behavioral scientists from the Center for Advanced Hindsight can be helpful to us, is to help us think through some of the ways in which people can be encouraged in ways that are effective to wear their mask. So I hope that's something we'll take on. But I am interested in the outdoor dining and where we are on that at this point.
Yeah, I just had a quick question also related to this. How do restaurants currently deal with, or I guess prior to this, deal with patrons showing up without shoes, without shirts, other things, with a dog that they want to come in? I want to emphasize that while the mask is a new thing, I think it's probably best if we actually fit it into an experience that people already understand, which is there are certain things that businesses are used to saying, actually, you can't come in unless you have X, Y, or Z. And so I think as long as we can kind of tap into that understanding and experience, I think that'll be a helpful, easy way to do it. So just kind of wanted to throw that out there. How have businesses dealt with that as a starting point for figuring out how do we help them think about ways to enforce, mask wearing and other things.
Yeah, and I was even thinking I'd almost equate it to the, you can't smoke inside a restaurant anymore, right? I mean, that's and that was new and that was a change. So how did we go through that and make that change, maybe?
Mm-hmm. Yeah, in the lodging roundtable, they made that connection and said this is really similar to if you had a guest who was drunk or doing something dangerous or annoying to other guests. Is the same kind of conversation that you would start out very diplomatically and become more insistent. I think in the case of hotels, I think it's a great question and important. One of the issues here, I think, is that in the issues around smoking and dogs or not wearing shoes, it's not quite as divisive and political an issue as this one is for people to deal with. And so there are people who feel like they are demanding their rights not to wear a face mask. But I don't know that the response to it is any different. I think the sort of diplomacy skills that one has to use to get a guest to comply with what you want them to comply with are very similar, and that's a very good point.
And of course, making sure that people have access to masks too, I think is just an ongoing reminder that we all need to have.
Yeah.
And I'd agree with that, but I think what we're going to see is, again, people challenging. This is unfortunately a political question for some people. And I know that a restaurant in downtown reached out to me over the weekend, or to a group, and Susan, you were probably on that email as well, where it just seemed, it was very obvious that the restaurant was not open, and it was very demanding, a small group, very demanding. We want to come in. This is stupid. Probably outside of Durham, I don't know that to be true, but I think we're just all of our businesses throughout Durham are going to have this experience with folks who are coming in demanding their rights and it being a political issue. And the question that was raised was, how do we deal with this? I don't want to put my front end staff in that position where they are getting into an argument with a staff person. So it is something that we're trying to help. And I agree with you. And I think somebody in the restaurant group did bring up, it's very similar to, you can't come in if you don't have shoes and a shirt on, and just kind of piggybacking it with that. But I think in the very early stages, as people try to push the limits, we'll see a lot of this as we open up, and just being supportive of the restaurants and letting them know we're not demanding that you enforce, do the best that you can, and then somehow to support them would be good. And I don't know what that looks like.
Can I just jump in? I think this also goes to thinking about with our public education and just what type of way that we talk about face coverings and just the information about why they're important and how we talk about that. I mean, I know, I really have liked the way Secretary Cohn and even the governor now has been talking about face coverings as a way you're showing your love. You're showing your love for other people in our community. You're showing your love for other people. And, this helps to keep everybody safe, and then why, and some of the data around it. Now, Marielle, hopefully you all can help us with the language, the messaging, and working with Dr. Akinboyo and Rod Jenkins, but there's so much misinformation out there about masks. I've seen it saying it doesn't do anything, it doesn't help people. I mean, that's just not true. And again, maybe there's some way we could support our businesses with having some type of campaign or information that's also very visible, or that can be given to people. I don't know what the answer is, but I do think that's going to be ongoing, because at the end of the day, all of this is about personal trust and buy-in from people. And that is being undermined in our country. But so I think it's just going to take all of us really thinking about how we can help support our businesses with this and the community.
Well, I know we need to move ahead in our agenda, but just briefly on the outdoor dining, you're right, Mayor, that we are hearing a lot of interest in that, and there's a lot of work going on to try to enable that and other forms of flexibility. So Nicole, if you wanted to.
Yeah, so we've been working very closely with the city staff. A huge shout out to Sarah Young in the planning department and Thomas Leathers in the transportation parking department. They've been great to work with, and others. I don't want to not mention everybody that's been helping us on that. We are to the point that I think they're working on a memo to send to senior staff on some suggestions. We've been getting some information now on how many restaurants just in downtown right now that would be interested in doing the outdoor dining. Rachel Wexler with Downtown Durham Inc. has been trying to sketch out how that would look, the best way that it would work, both in public areas and then in parking spaces in downtown, and trying to determine what it would look like in downtown. So I think we're very close. We were watching with interest what was going to happen yesterday at the state with the ABC ABC bill. And I too have heard the rumblings about the potential veto by the governor. It did pass, but that potential veto, the restaurants that we've been talking to are very adamant that this does not work if they cannot sell alcohol. Just eating outside is not enough. It will not make them even close to whole. So they've been very adamant about that. And looking at the ABC Commission and what they put out, it is very restrictive. The bill was a little more flexible in that it allowed outdoor dining in close proximity to the facility, the premise, whereas the ABC Commission's letter or statement was it had to be adjacent, abutting, or sharing a wall. That does not help in downtown areas. There are many of our places that would be very limiting, which was why it was great to have the close proximity to allow it to perhaps go down a sidewalk or be a couple of doors down in a public area. So we are waiting to hear what happens with that bill. But I would say probably until that time, it's kind of on hold. We may go ahead and submit so that it will be ready to go. But that's the one thing, the one unknown that we're waiting to hear, what happens with that bill now. But we certainly have a lot of interest, everyone that we have surveyed. We sent something out, a very quick email yesterday, but a lot of our downtown restaurants have come back in and said, yep, they'll be very interested. And I'm sure that that's across the county, businesses, restaurants who would like to use their parking areas and other things to do the outdoor dining. That's all I have, Brian.
Great. Well, we'll hear from Dr. Davis just very quickly on place of worship, and then move into some of these other items.
Okay. We were able to craft our unified statement about not reopening. We were able to get about 55 religious leaders, faith leaders, to sign on. We even had some who have tried to send their names in afterwards. So we're trying to see how we can add those. So that piece has been done. And we have agreement, as we said, for our second document, which would be kind of a best practices / procedures for those places of worship that either are opening or plan to open soon. So we've established a small subcommittee that will begin working with to kind of develop those practices. And then also something that we want to include in that, and this was really a suggestion from Ryan that we thought would be very great, would be as we're developing these best practices and procedures, that we also kind of look at them as somewhat of a case studies in which those places that do open before others will have access to professionals around all aspects to be able to help us best understand what was done, what has worked, how things have moved forward. We currently have, I think, 3 or 4 documents that different places of worship have either provided to us in the roundtable, or a couple of them were sent to Mayor Schul and he had them forwarded to us. So we do have something that we'll be starting with, trying to build from, but that's going to be our goal, to hopefully nail that down at our meeting next week and see that we can keep trying to make sure that our place is a welcoming place for places of worship that stand on different sides. So far, so good, knock on wood, but we'll see, and we're yet trying to expand and increase. Thank you.
Thank you so much. Brian, thanks for your work, and Susan and Reverend Davis. And Reverend Davis, I really want to thank you. The letter was beautifully done. So I know that was a lot of folks coming together and working on that, but really beautifully done. So thank you. All right, we're going to move into our next topic. We are a little bit behind on schedule, so I'm going to try to move us along, and we'll ask each of the groups presenting next to do your best to work fairly quickly through your topics. So the first one we have is vulnerable populations. And I think we wanted to get a very brief update on the work that has been going on around addressing the specific needs for our homeless population. So I'm going to turn it over to Drew Cummings to give us just a brief update there.
Thank you, Katie, and good morning, everybody. Can you hear me?
Yes, can. Thank you.
So I'm going to cover 4 things as quickly as I can. Firstly, the hotel shelter. That leads right into a conversation about continuing to shelter an adequate number of our homeless and how we propose to do that. Cover briefly the subtopic of sheltering our medically fragile homeless, and then a quick update on food insecurity. Okay, so hotel shelter. As most of you know, in early April, the county commissioners funded a contract with a 225-room Marriott RTP hotel. We have 145 people there right now. That is the full kind of case management capacity of the urban ministries staff who are there. Originally, Families Moving Forward, which is our main family shelter, was also intended to move to the hotel. They opted not to do that in the end. It took us a little while to get that hotel shelter up to capacity because we had already thinned out the population living in urban ministries to try to achieve social distancing. But we did get it up to capacity in early May. The current contract ends on July 10th. That's 6 weeks from today, and I assure you they will fly by. So we're working as expeditiously as we can to plan accordingly. That helps me transition to number 2. To adequately social distance, when we move the population back to urban ministries, we can only move about half of that 145 number back to the shelter itself. And that means that even nominally continuing to shelter the same number of people, we have to have some secondary sheltering options for approximately 75 people. This leads in part to the question of how to shelter about 1 to 2 dozen medically fragile homeless who really would not be good fits in any kind of congregate shelter. As many of you know, we have been working with Reinvestment Partners and Peter Skillern to firm up a proposal for about 25 beds, working with a number of funders for this population and a few others, including citizens returning to our community from prison. And importantly to note about this particular proposal, the beds in this facility would be available for a year with an option to extend for 2 years. So, you know, we think about how long, you know, the effects of this are going to linger and how long we will not be able to kind of pack people into a shelter the way we historically did. That may be quite important. So that, so the 75 people that we can't return to Urban Ministries, maybe now down to about 50 who would not fit at Urban Ministries, but who aren't so medically fragile that they need their own room. I want to observe that right now, our coordinated entry system for the homeless has several hundred individuals who have gone through the intake process and been identified as appropriate for shelter. Not all of these people are truly on the streets, but 20 to 30 are what we term priority 1 and are truly without appropriate shelter. We had gotten that number down, the priority 1 number down significantly in early May, but it has jumped back up, and I think it's safe to expect these numbers to continue to rise as our economic crisis deepens, as the relief check funds and the supplemental food benefits that have been coming through to people run out, and as with the lifting of the eviction stay. Again, I think it's safe to assume that those numbers are likely to increase. So the Homeless Support Task Force in the Emergency Operations Center believes that we need to move forward with the renovated motel rooms for the medically fragile, but also, and I really want to make sure people hear this and start thinking about this, that we work expeditiously to find, properly equip, and figure out how to staff 1 or more socially distanced congregate shelters for a bare minimum of 50 individuals, but ideally significantly more if we want to commit to truly meet the needs of this growing and really highly vulnerable population. Okay, that gets me to number 4, a quick update on food security. And I wish Donna Rewalt, who leads the Food Security Task Force in the Emergency Operations Center, and is a very capable leader of our county cooperative extension department. I wish she were here to give this update, but I did speak with her last night, and we'll try to give a helpful quick update. Many of you may be aware that, you know, the community of nonprofits and other groups active in this area pre-COVID was substantial. We have a lot of tools to work with, right, in our community in this regard. A lot of groups working in this arena. I see Dr. Davis there in the corner of my screen. I know his church is one of those groups, right, that has been distributing food week in, week out through this whole crisis, and we really appreciate it. But we need to continue to find ways to support all those providers and to commit to the concept that there's no reason for people in our wealthy community to go hungry. On the point of data, which has already been touched on today, hunger is a notoriously difficult problem about which to get really clear data. We do know that significantly increased food benefits are being delivered through various state and federal programs. But we also know that the depth of this crisis means that that is highly unlikely to be enough. Donna and her task force members, especially End Hunger Durham, are working to collect ever better information from this community of providers and other sources so that this group, I mean you, and our community can continue to understand the depth and the nature of the food insecurity issue as clearly as possible. And I will stop there and see if there are any questions.
Drew, this is Lois. Thank you for your report. Two quick comments. When Pilar, Ed, and I met with earlier this week with Constance and Linwood from Neighborhood Improvement Services, you know, they're out and about in the community and working with lots of partners all the time. They also emphasized food insecurity and just the need for food as a very high priority. So I wanted to say that. The second comment is that under vulnerable populations, I would love it if we also included there or someplace just an update on what is happening to reduce risk at nursing facilities and other congregate facilities, particularly where low-income people are primary and people of color are primary residents. I don't know if that's already under somebody's umbrella, but just given the data we saw this morning, that, you know, here in Durham and across the country, nursing facilities are really being ravaged by COVID. I think it would be, we need to keep it at the forefront for the task force as well as our community in general to be very concerned, particularly about what is often older, elderly individuals who may not have others who are looking out for their best interests.
I'll say our public health director may have some comments about the nursing facilities. I do want to point out, sort of with regard to food insecurity, that the county commissioners did approve a contract a couple of weeks ago that is helping to get significant food aid to many hundred low-income seniors in Durham Housing Authority and other senior housing facilities. But I realize that's a slightly different subpopulation than the nursing facilities, and I'll let Rod speak to those.
Lois and others, again, good morning. I'd be more than happy to provide a report for the nation in the interest of time for the next week's meeting. You know, as required or as asked by Drew, I could submit it to him. But just know that we've been doing a whole lot with long-term care facilities, to include a long-term care strike force, to include working with state emergency management to push PPE to these different areas. And also for me and my staff actually being on site along with Dr. Cam Wolf with Duke University Medical Center's Infectious Disease Department. It's been an all-out effort, but again, in the interest of time, Katie and Maticia, I will say that for the next time.
Great. We'll add that to the agenda for next time. Thank you. And Lois, thank you for asking that question. Really important. Drew, anything else? All right. Thank you. Great update and great work. And I know you continue to work with that group offline, and we'll get periodic updates. So thank you. All right, Rod and Pilar, I know we've already had some discussion around the work that we're doing for our Latinx community, but are there things you wanted to add to that and speak to specifically in this section?
Thank you. So the other thing I would say is I met with Councilwoman Javiera and Ryan and talked about starting the Immigrants and Refugees Roundtable. And our first meeting will be next week. But what we are thinking is including Latinx and refugees communities or leaders in this roundtable, and we see them as ambassadors and helping us connecting with these these communities, and probably try to find other people who we can plug in or bring into the other roundtables, because that has been my concern with the roundtables. How are we having representation from the Latinx and refugee community, immigrants and refugee communities? So we see this roundtable helping with that, bringing representation to the other roundtables of the task force, so we can have people from all the sectors. So we are talking about restaurants, construction sites, contractors, real estate. I know Pastor Davis has been doing a great job with the faith leaders, but also see if we can help with that piece too, and small businesses. So that's our goal, and we will have the first meeting next week.
Excellent. That's great. Well, we'll look forward to another update on that after your meeting next
Oh,
week.
and sorry, I forgot one important piece that we talk about, and is the talking about language justice in all, having this in all the roundtables, and not only communication, but also in all the conversations we have. So we are thinking in see how we can bring somebody to help with that also, because I think that's important.
Excellent. Great.
Katie, if I may, I'll just take exactly 1 minute and just say all the things. I'll try to say all the things that public health has been doing. But it's been great working with Pilar and the advocates for this dynamic community of Durhamites. Print and digital graphics in Spanish, we've done that. Health directive videos in Spanish with Spanish subtitles, we've done that. Informational video by Ana Bonilla, who's a foreign language interpreter, well received, we've done that. We've set up a Spanish email listserv, provided talking points to the community organizations to get the word out, certainly presented data to community organizations and activists to help spread the word. And we have significantly increased our number of staff who are available for translation doing our case investigations and case interviews and contact tracing. And we've done a number of Spanish videos, and we've done some filming. And I had the great privilege of working with the group Isla on Tuesday. I'm getting my dates mixed up. Tuesday for Facebook Live, where I was interpreted, and that was different, but it was highly effective, received over 2,000 views. And again, I promise 1 minute. It's been a whole lot, and we have a lot more to go. So again, we look forward to continuing to help this population. Thank you.
Excellent, excellent work. Thank you so much for both of you for your leadership in this.
Katie,
All right.
Katie, can I add one thing really quickly?
Please.
Just to say that through Ryan's good work, and the city manager has agreed to pay for language services for our group, for the task force, and really appreciate that. Also want to say Wendy just texted me and said, "Isn't it great that our public health director is so can-do?" And it is. I just really appreciate Rod's attitude, and he's thrown into a situation when he just got here of a pandemic, and has really taken a can-do attitude, as you all can hear. And I'm just so grateful for that, and appreciate Wendy sending me that text so I could just forward that to everybody.
Pleasure, sir. Thank you all so much.
Thank you. Thank you very much. I want to move right into the PPE discussion and securing face coverings and masks. And I know, Ed, you've been doing, again, a tremendous amount of work on this. So I will turn it over to you.
Great, thanks. Good morning, everyone. I'm going to dive in. I actually sent over some documents or some data points that I pulled from some of our research, and you may didn't get them to this morning. I sent them over pretty late. I'm going to read a brief overview of the reporting and then kind of jump into kind of some action items. We've been charged with the responsibility of developing plans for securing enough face coverings and/or PPE deemed necessary by our public health experts for all businesses and residents of Durham. At our last meeting, I reported that we had identified our needs, a proposed timeline, and established a skeleton of matching solutions. The timeline of needs we offered was divided into 4 terms, those being our immediate needs over the next 30 days, our short-term needs, next 30 to 90 days, our midterm needs, 3 months to 1 year, and our long-term needs of 1 to 3 years. Today, I will focus most of my report on our immediate needs, again, those dates being between June 1st and July 1st. However, I'm open to field any questions, comments, and/or concerns regarding our entire timeline. As June 1st approaches and Durham seeks to continue its safe reopening, along with a widespread public health campaign promoting the necessity of wearing face coverings in public spaces, in our immediate term, we are recommending a procurement process to obtain the needed face coverings and/or masks for the residents and venture leaders of Durham required as we interface two of our safe reopening. I wanted to denote that breakdown in the in our needs. We're moving from this procurement phase in our immediate needs to a long-term goal of actually creating this ecosystem here in Durham, where, from an economic standpoint, we're not sending monies outside of Durham to take care of the needs of Durham. But we can revisit that at a later time if needed. For our immediate needs, we have identified a local Black woman-owned company that is a PPE supplier and has the capacity and bandwidth to fulfill our needs quickly. Eva Perry of Carriox Solutions has submitted a proposal based on the demographic range of the needs Durham has, while price points in the PPE industry have been consistently fluid, I asked suppliers to submit proposals based on the numbers they could commit to over a 7 to 10 day period beginning today. Just to expand on that, as the market just begins to get flooded with face coverings and PPE that are, let's say, not up to standard, so to speak. And, when people just kind of go online or contact the supplier, there's no way for them to know whether or not what they're purchasing is actually going to help or actually serve their need. Various entities, whether it's the CDC or FDA, are continually updating their approval process. In a few conversations this week with suppliers, there were expectations that the FDA, if I'm not mistaken, would be updating their metrics, today, if I'm not mistaken. And because of this kind of a consistently fluid process, price points from suppliers and manufacturers are just going, up and down. Initially, they basically were at a certain level, and then before many stay-at-home orders were enacted, people began to make a rush on manufacturers. Just so happens, because of so many stay-at-home orders, the demand to actually receive face coverings and masks it reduced, or, you can say it either reduced or it didn't live up to expectations. And so, that being said, manufacturers and suppliers were sitting on products that they had hoped to just hurry up and sell or get to the public. Because of that, there began some price gouging, things of that nature. So I just want to kind of give you a eye on why that window is what it is. Again, as I just stated, I asked all suppliers to submit proposals based on numbers they could commit to over a 7 to 10 day period beginning today. I've also sent a product deck from Carriox Solutions. Specifically, if you look on the deck, the KN95 mask and the surgical mask, the 3-ply, are what I've had quotes submitted to us for. We went through a ton of demographic data over the last week, actually, to ensure that we could meet our needs, or that we had the numbers that would meet our needs. That demographic data was around population, it was around employment, unemployment, etc. And we juxtaposed that data with the Durham requirements of actually everyone being in public having to actually wear a face covering. To surmise all of that, there's roughly 170,000 plus employees in Durham, and of the 320 or more thousand residents in Durham, about 17% of those live at or below the poverty line, which brings us to roughly around 50,000 people. Based on those numbers is how we created the metrics that we're asking, or that we're recommending. Employers are being asked to provide at least 3 face coverings per employee. There's an assumption, obviously, that getting in the door, you're gonna at least have 1, maybe 2. So we did numbers on basically that population of about 50,000 50 to 100,000 actually residents in Durham who there may be a financial burden in actually obtaining these masks. And we did numbers based on the employees of these 170,000+ employees, the assumption that all of them are not citizens of Durham. Obviously, this area is heavily traveled. That being said, employees that come here, they should not be an assumption that they will all also already have a mask. That brings us, if we do 2 per one at 170 and 1 at 1 unit per 50, brings it roughly around 390,000 units. The quotes that I had were based on numbers between 300,000 on the low end and 1 million on the high end. You all have the numbers and how they stand. And I'll kind of wrap up that and field any questions, comments, or concerns.
So thanks for all your work on this. I do have a question on the masks that we're looking at. Are these, and I wasn't clear because I've just quickly glanced at the information you sent, but were these reusable cloth masks or are these the disposable masks?
I think the surgical masks I think those are the ones that are disposable, but there are reusable cloth masks that are available as well. Because of the timeline, and we know that courts and et cetera are going to be opening up next week as well. One of the things that kind of extended or differentiated this particular supplier is that they were able to, there was a 1 to 2 day turnaround that they could guarantee. And they could guarantee a 1 to 2 day turnaround over up to 1 million units because they actually have they actually own warehouses in the United States. Some of the other suppliers didn't actually have their own warehouses, so there was actually, they're obtaining them from various manufacturers and then transporting them. Some suppliers we talked to actually used to own warehouses, but because of the fact that there was just a rush on inventory, they actually sold their warehouses because they were basically just buying and moving, and nothing was ever hitting their warehouse.
Okay. Okay.
Was there any discussion on how to distribute the masks to people who need them most?
Yeah, there's been a lot of discussion around that. So we've been talking with our initial conversation were with Cover Durham, and we've had various discussions amongst several different entities, several different informal entities. Let me put it that way. But we don't have a plan in place right now for how we would disseminate those to ensure that everyone has one.
So maybe that's something to work on over the coming week or so, is to really start thinking about that plan of how we would distribute and thinking about, is it that businesses would tap into this source but the businesses would be providing the masks for their employees? Is that the concept?
Right. So in our discussions and our research, what we found is that there were, amongst this great need, that those needs were even divided, right? So there was a need for all of us to have masks, and then there was the need, either a financial reason why some could not afford masks, or there was an additional need, and what I'm hearing from a lot of businesses, that they just don't know how to tap into a supply chain. And to be able to avoid some of the price gouging and things of that nature. I mean, we've heard from I've actually talked with municipalities that tried to get into this space, a couple of months ago, and just the clutter around that. The municipality itself, a fairly large size city, wasn't nimble enough to follow through, and they gave up. So our hopes is that we can create this supply chain where if nothing else, at a bare minimum, we're able to serve as a vehicle so that businesses know exactly where they can find these masks.
Great, thank you. Other questions that folks have?
I thank you, Ed, for doing all the work on this. And I mean, the PPEs are just a really fundamental issue. Everybody is going to need PPEs. I mean, on our MAC call yesterday, we were talking about Durham County needs, Durham City needs, Durham Public Schools. I mean, we think about all the employees, the children. It's really enormous, our businesses, and then the scarcity and the price that is going up. So this is a big issue. Jody, I'm wondering, I mean, Jody is our representative to the EOC. I know funding is an issue. And I think also thinking creatively about what is going to be the best way to tap into at least this source that you have. Now these are disposable, which is different than the city, the county, and Durham Public Schools. All of our elected leaders, we're using our travel budgets. Actually, we're spending about $67,000 to buy the ones that can be reused up to 25 times, that can be washed, and are going to be targeted with vulnerable populations with the Community Health Coalition. But this is different. You know, these are the ones that our businesses are going to need, and employees. So I don't know, Jody, if you could maybe speak a little bit to how you think we may be able to connect this issue between the task force and what's happening at the EOC level related to this PPEs.
Certainly, Madam Chair. I had provided about 2 weeks ago to Ryan a list of all the sources of PPE that we're aware of organizations and businesses and vendors that had contacted us. We had been keeping a running list of that information and contact information as a place to start to share with Durham businesses. And I'll say that we've collected the information. We have not vetted all those vendors. So we would really want any business that would want to reach out to those vendors to make sure they do their homework. But at least it provides a place to start looking at what the needs for specific businesses would be. And so as that information, as we continue to collect information, we'll continue to provide it as well. And to Ed's point, it sort of builds up an inventory of list of people that I think the task force could be a resource for, to share with the roundtables, to share with our businesses as a place to start, especially as we continue to move to more of a reopening phase. But it's also going to be a long-term issue. And Madam Chair, as you mentioned, this is an issue also of supply chain and being able to get the kind of materials in a timely way. And so whether you're a private business or a public organization, this is going to continue to be an issue that we're going to have to deal with as we continue to respond to COVID-19. But I think the place to start right now is the connection of information sharing between what we have at the EOC and what we've collected as far as possible vendors, being able to share it through the task force and be able to provide it as a resource for our roundtables.
And I think, Ryan, that information is included for all of our task force members. Is that right?
Yes, in the briefing materials you have, there's an online resource where I save documents for you all, and I included that under the PPE tab so that you all have access to that, and I can circulate that also as a follow-up.
Okay. Can I ask a question maybe for Rod or Dr. Akinboyo in terms of, as we look at businesses and more administrative work, are cloth masks acceptable, or should businesses be looking at more disposable masks?
So I think that depends. I think we can probably both weigh in, and just depending on what perspective you're looking at. We know that transmission is higher in some settings. And so if your face covering doesn't have enough integrity, or you're more likely to get it soiled, or you're more likely to move it around based on your location. And I think it makes more sense to have something disposable where you don't walk outside of that area with the same face covering. But in most other settings, either where you can have some distance from others, or even if you can't, you just need to cover your face. I think any face covering should be sufficient in that setting. And I'll defer to the CDC guidance for specific settings, and certainly Director Jenkins about what the plan is.
And I concur with Dr. Akinboyo. Again, it does depend totally on the settings. And we would defer to the CDC guidelines for that particular type business. So again, just really looking at those type businesses on a case-by-case basis. But I totally would agree with Dr. Akinboyo.
Excellent, thanks. Ed, you have done tremendous work in 2 weeks. I mean, if we think about it, really, just outstanding. So I think it's great that we have some, really good information. And I guess in terms of next steps, what do you see as the key steps for next week and the work that needs to be done? And how can we help?
Next steps, we're drilling. So we spent the bulk of this week. So last week we gathered just kind of data and tapped into supply chains kind of locally, nationally, and internationally. This week we spent the bulk of our time just vetting businesses. Next week, again, I want to mention something as well. To the point around the cloth face coverings, the issue that I did not bring to the table here is that many of the suppliers of the cloth face coverings that we found weren't as standard. And because they weren't as standard, we couldn't kind of stand behind them, so to speak. Even in our conversations with Isaac and Cover Durham, their initial conversations with the face coverings that they were going to use was with a certain manufacturer. I don't want to go public with that. Didn't test well when they came back, and that's the reason they kind of had to pivot at the last moment. So that was an issue. The second issue with kind of the load, so to speak, on the cloth face coverings, many manufacturers have actually created or companies have turned their manufacturing process around to actually focus on surgical masks, things of that nature, and not the cloth, and not as many on the cloth face coverings, just because of the sheer need and the volume. And so the ones that we were able to reach out to, even the ones that Cover Durham are in the process of attaining, they could not guarantee any more than 100,000 in the course of a month. They just didn't have the capability. So over a 30-day period, if we were going to need 10 times that amount, and knowing that they haven't even really kind of dug in on this initial order, that just didn't fulfill the needs that we had immediately, or and locally. So those things were taken into account. Also, what has been taken into account, and it continues to be on our radar, is the fact that there are several, let's say, micro entrepreneurs throughout the Durham ecosystem that have stepped up and began producing these fake cloth face coverings as well for their own communities and through their own networks and through public networks as well. But even those, they're only averaging, delete only, because I don't want to minimize anyone's efforts, but they're averaging anywhere between 15 to 30 face coverings per day. So still, even in that aspect, it doesn't really supply this immediate need. Our timeline, actually, there's space in our timeline where we actually circle back around and are able to bring these micro entrepreneurs into the ecosystem, so that they don't spend the next 3 to 6 months as a entrepreneur basically, and then be asked to then just become an employee of a larger manufacturer who has decided to do something. So we're actually thinking through that as well. Over the next week, we're actually drilling down on narrowing those top 5, so to speak, that we have. Hopefully get those down to a top 3, And we actually would prefer to work with between 3 or recommend to work with between 3 and 5 suppliers initially, based on the needs that we have. The reason we would rather go with between 3 and 5 as opposed to 1, who we look at it from a perspective of it becomes either we're swinging for a home run and we get a strikeout. I mean, if it's just business and the numbers are the only thing that matters, and the consequences are just, you know, we can absorb the consequences, then, you know, I'm an entrepreneur. I don't mind swinging for the fences. But I think in this case, a strikeout actually means life or death in some cases. And that's just not something I'm willing to bear. So if we go with 5 and 4 of the 5 tend to deliver, you know, we at least have a reasonable chance of success around 80%, right? And so that's why we're looking at those numbers now. Moving past that, we're going to spend an insane amount of time just actually trying to drill down on this dissemination of these products. We know this is going to take a multifaceted, multi-tiered approach. I mean, we're a very diverse population in Durham. Businesses run the gamut, neighborhoods run the gamut, but we also acknowledge the fact that there are already ways to do these things, right? So these various communities, neighborhoods, businesses are already disseminating information. They're already disseminating things to their communities and to their employees. So we don't want to waste time reinventing the wheel. We just want to make sure we can tap into what we would consider, marry into what we consider their already existing acceptable forms of communication. So that's where we're going to spend the bulk of our time over the next 7 to 10 days.
Okay, excellent. Well, we'll look forward to another update next week, and really looking at that dissemination and getting that narrowed down. And please feel free to pull in whoever you need to help with removing any barriers for you.
Great, thanks for your help.
Thank you so much for your leadership on this.
Katie, can I make one comment about masks?
Please.
And PPE. I appreciate Ed's work so much, and everyone who's been working on this. It seems to me like there are 2 different questions that are related, but 2 different needs. One is, as Ed referred to, some sort of warehouse where we know locally there's a guaranteed supply that our businesses can go and get PPE at a reasonable price. And it seems like Ed's identified at least one and more than one vendor for that. But that seems like a big need. And Jody talked about that too, the list of vendors that we can make available and so forth. And so one thing I'm interested in is kind of continuing to push on is that what is the genuine local availability for, you know, restaurant X that just needs to get some face coverings today, you know, or for the next week. What do they do and how do they do it? So that's one thing. And making sure that exists. And then there's the related issue of, but it's not quite the same, of covering our vulnerable populations. Wendy talked about the fact that we're spending some of our public money on that, but trying to continue to quantify that need and figure out how it's best met. And what kind of funding, private or public, is necessary for that. So I just want to try to divide those needs into 2. I think they're 2 different needs. They're related, but not quite the same. And so just as Ed and everybody is pushing that discussion forward, I hope we'll think about those 2 things.
I think that's an excellent point. And maybe, Ed, it may be helpful for you to work with the vulnerable populations team around, they may be able to really help with that dissemination to our most vulnerable in our community and coming up with that plan.
Thank you.
Excellent point. Thank you. All right, I am going to ask for about a 2-minute update on voluntary cooperation, maybe 3 minutes, 3-minute update on voluntary cooperation, and then we will have a more extensive update next week. But
sure. And I'll keep it brief, and I'm also happy to send out sort of a little bit more extensive notes to everybody on the task force. So we're kind of really taking these three approaches in this voluntary compliance piece, which is the checklist as a kind of core piece of that sort of self-assessment for businesses. Another component is actually we are thrilled that that McKinney has actually donated some time, effort, staff to support on helping also create a toolkit for employers that will include sort of best-in-class signage, things like that, to help make it easy for them to follow and implement. And the third piece, of course, which is the larger communication strategy that Susan and her team are driving forward with. So I just kind of really wanted to highlight a couple of things about the checklist, because that's kind of the very first thing that we are working hard on. And a couple of things that I wanted to note is that, again, emphasizing this is a completely voluntary process. We don't see it as a requirement for a business to open. It really is trying to answer the needs that we're hearing from the different business roundtables. And so the things that, we're hearing that Brian and Dr. Davis and some of these, and Susan and Nicole have been talking about, the things that are coming up is really that businesses want guidance, and that they want to know really concrete things that they can be doing to make sure that they're able to open and stay open. And so we're really thinking about this as very much as a tool that is providing that very clear, actionable guidance for businesses. And we're really thinking about how do we make sure that we're giving that to them in an actionable way. And so that's why we're really thinking about this pairing of the Count on Me training plus the checklist as that strategy. One reason to have the checklist as that companion tool is basically there's lots of evidence in behavioral science that education and training are less effective if they're not paired with a tool. And so really wanting to make sure that we have that tool comparison. And just an example of this is that there's some really nice research that shows that actually even introducing a checklist for surgeons, which is sort of one of the highest trained professions in the world, basically introducing a checklist for surgeons helps decrease death rates from 1.5% to 0.8%. It reduces serious complications during surgery from 11% to 7%. So it really is about this pairing of training with a tool that helps make those things actionable, reminds people of the things that they should be doing and putting it in easy, accessible ways. The other thing that we're hearing as well from communities is that people still feel unsafe, and that they're not going to be supporting businesses unless they trust that the business is doing everything that they can to keep them safe. And so that's really kind of another component of the goal of this checklist, is to make sure that we're also making some of the invisible things that the businesses are doing to keep it safe, to keep it, to protect visitors, helping make some of those things a little bit more visible for visitors so that when they are coming to visit these places, they have a little bit more confidence in what's happening, a little bit more transparency into it. So that's kind of the two major components of the checklist. Is having that, so kind of that guide of those concrete things to do, plus the front-facing display to customers of what are the top things that they are doing. I had some notes on some of the behavioral science pieces of this. The general assumptions are that people have limited attention, so it's very difficult to pay attention to small details, even when they're important. So we're really thinking about how do we make sure that we remind people of the important small details in timely ways. Even the smallest friction to doing the right thing will actually deter the best of intentions. So if it's hard for someone to get a mask, they won't wear one. So again, going back to the importance of making sure that PPE is easily accessible, it's given to people. If people aren't sure where their closest test site is, they'll delay getting tested. So really basic things about how do we make sure that, and we're thinking about that for businesses as well, making sure that it's really easy and clear the things that they can be doing to reduce risk. And then the last thing is that we know that humans in general don't understand probability well, and we don't understand risk well. And we can both overinflate and underestimate our sense of risk. And so one also aspect of this checklist is helping people actually think about their risk in context for the business. And so essentially the description, sort of general flow of the checklist is that they start, it's a digital experience. They start first with just basic information about their business, type of business, et cetera. Then there is a very sort of simple risk assessment that has to do with how close proximity is there between staff and visitors, how many visitors are in the business at any given time, what's the general duration of time that people are in that business. And so kind of a very simple little risk assessment to help the business sort of think about to put some of that risk in context and understand what makes things riskier or less risky. Again, going back to making sure that this is informed and rooted in public health. Then it will go into the checklist that are great, understanding your risk. What are the things that you're going to be doing to help reduce your risk in these different areas? And that's that checklist. So that's that second piece. The third piece is then it will be because this is a digital experience, it'll then have a nice display for the business that sort of summarizes the things that they are doing and sort of reminds them of other things that they could do if they wanted to or were able to do even a little bit more, that they can then sort of print out and give to their internal staff. And then there will also be a PDF option, and this is a big piece that we are going to recommend that people do, is that we'll take some of the major things that they're doing, some of those top things, and really sort of port it out into a nice, well-designed, front-facing sort of a piece of paper that can go that they can print out and post in a highly visible place that summarizes the key things that they're doing, but it's customer-facing to give that comfort. So yeah, a quick timeline and next steps. We are almost ready to share our first draft with the public health experts. So those of you who are on this call, expect to hear from me today with our first draft, because we want to make sure that we are accurately representing risk and that we are, I would note that the checklist items are based on CDC guidelines, but we want to make sure that we're interpreting those correctly, et cetera. So we'd love to, expect to hear from me at some point today. And then the next step after that is once we've been able to incorporate and get that feedback and approval from the public health experts that we have, then we'll be reaching out to Brian to help coordinate the different roundtables, making sure that they're weighing in the checklist that's unique and specific to that business.
Great. Thank you so much for all your work on that. So we'll look forward to an update on that next week, as well as an update on PPE, continued updates on our roundtables and where we are. At this point, we will have restaurants, personal services, pools will have been open for a few days, and so getting an update on that. Maticia, I know you wanted to also talk about thinking forward to phase 3. So why don't you, I know we've only got about 3 minutes left, but maybe wrap up with that point, and then we'll end the meeting.
Okay, thank you very much, and I'll try and go fast. I think, all of you know that Governor Cooper's plan to reopen the state is a 3-phase plan. We're in phase 2 with some modifications to what was originally in the phase 2 plan. As we get closer to phase 3 and we think about our specific purpose to advise Mayor Schewel and Commissioner Jacobs on recovering and renewing safely in Durham, it's important for us to go ahead and start thinking about what phase 3 could mean for Durham and share our thoughts with Mayor Schewel and Commissioner Jacobs on what we think is best for Durham. So since we're out of time, my ask of the task force is to start giving that some consideration, and maybe in our next meeting we'll have an agenda item where we can possibly hear from Mayor Schewel, hear from Commissioner Jacobs about what they think will be in phase 3. I think we can expect things like bars haven't opened, fitness centers haven't opened, sports and entertainment venues, increased capacities for places like restaurants, personal services, and other things that may be coming. So my ask is to go ahead and start thinking about that so we can get in front of what may come out for the state and make some recommendations specifically for Durham.
Great. And maybe if I can just add on to that, Brian, if we can look at getting set up the roundtables on sports, and then the roundtable on, I think we had one on sports that we were slated to do, and then one maybe on entertainment venues. And it's probably a good idea to go ahead and get those organized so that we can begin to do that work.
We're working on sports. We're working on a date for next week.
Perfect. Thank
And,
you.
you know,
so much.
as we got great guidelines from DHHS, but we're trying to have somebody on the call to help us with that.
Okay, great. Thank you. Thank you so much. All right. Thanks, everyone. Appreciate all the incredible work, and let's keep it up over the next week.
Katie, can you remind people, or could someone of the public forum at 11, just as a quick reminder to those if they want to join?
That's right. There is a small business forum at 11. I don't know, Jeff or Mayor Schul, if one of you has any more information you want to share on that.
I'm happy to go, Jeff. We have a small business forum today at 11 o'clock. It's open to anyone that would like to listen. It's a public meeting. It'll be moderated by Christopher Gergen, and it will mainly be hearing from our small businesses about what their concerns are, especially around financial support going forward, but they may have other concerns that they want to discuss as well. And it's scheduled to be for an hour, and you're most invited to attend. Did I cover it, Jeff?
Yeah, that's perfect. Well said, Mr. Mayor.
Excellent. Thank you so much. All right. Thanks, everyone. Have a good weekend.
Thank you, Katie.
Thanks, everyone.
Thank you.